Hello everyone, welcome to this presentation. My name is Kollarou Anna and I'm a molecular biologist and now I'm currently working in secondary education schools on the island of Milos. This presentation is the result of a collaborative effort with my brother Kollaros Alexios, who is a chief nurse at Theageneion Hospital in Thessaloniki. Together we aim to explore how principles from public health, like prevention, organization, and particularly leadership practices in clinical settings, can serve as a model for leadership and organization within schools. Our goal is to highlight how interdisciplinary approaches can strengthen educational environments, especially when inspired by systems that prioritize care, coordination, and resilience. Schools today are more than places of learning. They are ecosystems facing social, emotional, and health-related challenges. The COVID-19 pandemic showed us that traditional models are not enough. We need leadership that anticipates problems, not just reacts to them. Public health provides a framework based on prevention, trust, and planning. It prepares in advance, uses data ethically, and relies on visible leadership. These practices are highly relevant for schools that must support both learning and well-being. One of the greatest lessons from public health is the preventing mindset. Small, proactive actions taken early can prevent crises from escalating. For schools, this means building safety policies, health routines, and a culture of readiness and inspires trust among students and families. The strength of public health lies in its principles. It anticipates, it collaborates, and it communicates openly. If schools embrace these principles, they can become proactive organizations that care for both academic success and student well-being. Communication is more than announcements. It is about clarity, transparency, and empathy. In times of uncertainty, clear information reduces fear, while active listening shows respect. This combination strengthens relationships and builds credibility for leaders. School leaders can adapt public health strategies by looking at students as whole persons. Leadership is about visibility and empathy. Schools, like hospitals, should have readiness plans and should use data for support, not punishment. Public health reminds us that care is ongoing. Schools are small communities where prevention and empathy must be part of daily life. Even small, consistent actions like safe spaces or well-being checks can strengthen the school culture. Just like public health, schools must address inequalities directly. Vulnerable students often carry extra burdens, and leadership must ensure equity through inclusive policies and practices. A caring school distributes resources fairly and actively prevents marginalization. Supporting mental health is not a luxury, it is a necessity. Schools that include simple practices like check-ins on mindfulness see improved behavior and stronger bonds. Partnerships with health professionals enhance these efforts further. Schools can achieve more when they join local health networks. Collaboration with clinics or prevention centers allows them to offer programs that extend beyond academics. This mirrors the intersectoral approach of public health. Health belongs across the curriculum. Whether in literature, sports, or even digital safety, teachers can embed well-being topics in their lessons. Early intervention is key, since many health problems originate from habits formed in youth. Public health shows that strong social ties protect well-being. Schools can embrace the same idea, creating cultures where students feel safe, respected, and supported. This culture of care is the foundation for resilience. From Sweden to Canada, we see how public health principles already shape education. Sweden embeds well-being teams in every school, while Canada's crisis planning ensures readiness. Both systems demonstrate trust, clarity, and prevention. In Greece, schools partner with local agencies to deliver health education and disaster readiness. In Spain, schools serving Roma communities adapted to the pandemic with resilient strategies. These examples show the power of collaboration. In Finland, schools don't work alone. Leaders make decisions with health and social experts, reflecting public health teamwork. This holistic governance ensures that students' well-being is never seen as secondary to academic outcomes. Of course, challenges exist. Not all systems have the same resources or flexibility. Bureaucracy, inequality, and scalability remain barriers. Acknowledging these limits is essential to refining and sustaining the model. The lessons are clear. Schools that embrace prevention, ethical use of data, and community ties become more resilient. Leaders who are present and empathetic foster trust, while continuous care shapes healthy learning environments. Just as public health systems collaborate across borders, schools, too, can benefit from international cooperation. By sharing practices and learning from others, local education systems can strengthen their responses. Global crises, from pandemics to climate change, require solidarity, and schools can play their part by mirroring this cooperative model. To conclude, public health gives us a model of leadership built on care, readiness, and community. Schools that adopt these principles can become safer, more inclusive, and more resilient. A caring school is not just good for students, it is a foundation for a stronger society. Thank you very much for your attention.